long as possible to evacuate all.
And they have synthetic. Seem like it's still surgery's still bad. Cataract surgery bad. 58 calories. Look like this. Invented by a man by the name who got to French Army. And the muskets or the rifles they had rifling on, so they would spin. And this was a very, very accurate weapon. And when it hit, being soft lead, it begins to flatten out. This is an original. And it flattens very flat. And when it hits something, it can hit your shirt, it will start to flatten. It's okay, like you spin the thing, it will flatten or maybe even split. When it hits the bone, it may split in 3 or 4 pieces, but it hits so wide and so hard, and at its speed, it cracks the bone up on the side. It may shatter. A piece may follow up the bone, up into the abdomen. They've had a lot of that happen. When I believe it was Abraham Lincoln's autopsy, there were 2 pieces of lead in his brain. It split. But during the beginning with the war in Afghanistan, there was a lot of soft lead bullets being fired at our troops, and they were suffering wounds like Civil War guys. And to give you an example what that soft lead can do to a 55-gallon drum, I was fired. A friend of mine shot it from his Civil War rifle. See a little ding here that's not all the way through, not enough power to penetrate. 2 small holes, full metal jacket. They do a lot of damage, but it's more localized than with these things. All bullets. But with those lead bullets, when it would hit, it would literally, you figure this boy's arm right here. Those folks back during the war between slaves were not like us. They didn't have a lot of extra adipose, I think. They weren't fat. Had very little fat. And that bullet would hit them, the bullet would hit them and it could just tear a limb off or have it so badly damaged. They'd come in, the surgery of choice was an amputation. It took about 15 minutes, sometimes less. The doctor would put them to sleep using either a chloroform and a cone similar to this. It would be a drop of anesthetic for respiration or so. When the fellow went out, or went to sleep, surgically unconscious, have a tourniquet placed, tighten it down. They would lift his leg up, they'd take a scalpel, they would go around, cutting down to the tissue. They would take a cattle and hook on the artery or vein if they cut it. If they hadn't, they would tie it off, put a ligature, what's called a ligature, made out of silk or horsehair. They used horsehair too. It would dangle to the side, he'd cut on through, tying them off. When he got to the bone, his assistant would pull the tissue back. Usually they put cloth in there made like a three-piece thing where they could pull that tissue back off the bone. Then they would go in with the bone exposed, cut that bone off, toss it in a pile. Then they would take the bone nippers or rungers and trim off the bone at a slope, sand it down. They had like a little file, bone file. And then they'd pull that flap back over and they would sew it up using the silk. The ligatures would dangle to the side. They'd put a dressing on it, lay them to the side for transportation further back. Another guy would take his place. Same knife, same saw, just like it was when it was here. If it was too greasy or bloody, they would wash it off. Otherwise, they would wipe it on the uniform or on their apron. The basin you see down the bottom with the sponge in it, this one deal here, the sea sponge would be with water. That would mainly be so they could see the wound, to get an idea of the damage. Bullet wounds, they started out with this as a probe. Well, this carries all kind of bacteria. Into the wound, couldn't feel it. Then they would get a probe. They would go down in, had a porcelain tip on it, go down in, tap on it, pull it out, put a little lead deposits on there. Oh, that's a bullet. They would open up where the entrance was of the wound, go take their bullet forceps, which are these fellows here, go down into the wound, And as they penetrate it down in the wound, they find this bullet, and then they pull it out. But the ones that had to have an amputation, they still had a battle to get over, and that was the chance of gangrene. If they went into some of the field hospitals that were tents, they survived better. Better ventilation, less bacteria. Surgeons at the time didn't know that bacteria caused disease or infection. They had no knowledge of the germ theory. So these guys got infected. They look at it and say, oh, it's healing real good. All this pus is coming out. It's called laudable pus. That's good. They would have a heart attack. And as it healed, and he didn't get gangrene, he had another battle to fight, and that was being able to walk again. And some of them, you can see pictures of some of the guys with peg legs, some of the guys with artificial limbs. Artificial limbs became big business during the Civil War. It also almost bankrupted many states post-war by supplying these soldiers with artificial limbs. Some of them were quite interesting. Some of them were just rough. And one was for enlisting, one was for an officer, or if the enlisted could afford to buy it. Most of the enlisted guys, as a rule, were farmhands. They came into the military, they were trained, they were put in a camp like that. One boy comes down with measles. Guess what? Every one of them comes down with measles. Mumps, chickenpox, whatever. And some of the side effects of these childhood diseases, pneumonia. Needless to say, you're going to have a lot of deaths. So they had a lot of them die. And Robert E. Lee sent a letter to Jefferson Davis saying, would you please not send these boys to me until these diseases have passed? And Jeff Davis didn't honor that request. They kept getting them. And many, many, many battles or skirmishes or whatever were afforded because the troops were too sick to fight, or there weren't enough troops to wage a fight. It was too off-centered. I just finished a book called The Diseases of the Civil War, and it talks about each battle. This battle here, they had scurvy. The Confederates had scurvy real bad. Time of the year, March, April. In these areas, after the winter months, fresh vegetables hadn't come about, so they've been eating hardtack, salt pork, no fresh vegetables. So they had scurvy. You get scurvy, you get rashes and bleeding into the skin, your gums bleed, your teeth can actually fall out. You're a pretty sick fellow. But when you get wounded, you have better chances of infection. So a lot of that. There was a doctor by the name of Dr. Chisholm. He was a Confederate doctor, quite brilliant. And he wrote a manual for the surgeons. And you got to remember, prior to the Civil War, there were not a whole lot of gunshot wounds. You didn't have a bunch of drive-by shootings and things like that, you know. But with the advent of the Civil War, all these bullets were sailing through the air, and now no doctors had training hardly in it. So he wrote a book how to treat it, and it has pictures in the back. And there's stories where they were actually holding the picture up so the doctor could make his cuts, which makes sense. In the old Army thing, see one, do one, teach one, you know. He came up with this little article. It's called An Inhaler for Anesthetic. Pop the top off. It's got a little sponge down inside of it. You put ether or chloroform, usually chloroform. Put it back together. Put it in the guy's nostrils. You hold your finger over here where it wouldn't evaporate. All right, inhale. He breathed it in. Inhale. Next thing you know, he's out. They use that. That worked with it. What else? Drop anesthetic per respiration is about what they use. Oh, one thing with ether. If you put, ether's flammable, so it's dangerous. But there's stages that you go through when you have ether. And one of them is the excitability stage. And you're trying to get up off the table, you're talking, your arms are moving, your legs are moving. So they would kind of hold them down to protect them through that stage. Soldiers marching by thought they were holding them down and cutting the body parts off of them without anything from them. Did they run out of anesthetic? Yes, they did. But they tried to keep plenty on hand. Women, and you see these women with their big dresses, they would go across the line, buy it or get it, whatever, and they had little pockets sewed in the undergarments, and petticoats, I guess is what they call them. And they would carry them back. And there was a story about one gal brought 2 sets of cavalry boots back. I could just imagine how she was walking, carrying those things. But they wouldn't search for them. And that's the way some drugs were brought in. Of course, the blockade runners brought stuff in. Stuff came up through Mexico. They started making a lot of drugs. They weren't as good as what they had. What's his name? Dr. Posha came up with Jefferson Davis, said, I need alternative drugs using field and forest. And he came up with a book about yay thick on drugs from field and forest that have the ability to do some of the foreign drugs that they had from England or wherever, South America. And they used some of them, and they weren't very effective as a rule. They had some effect, but they weren't as good as the real McCoy, if you would, the real stuff. And of course, after the war, they stopped using them. Except my grandmother used to use them. It's called herbal medicine. She used a lot of that on me when I was